136 Adams Street was a special place. It was where we lived and where my father made his living. It was a very intimate relationship between his practice and our lives, because his office and waiting rooms were on the second floor and our bedrooms were just down the hall. People were honest and people were honorable. Sometimes they were next door neighbors, sometimes they lived 5 or 6 miles away, but it was our life.
Jordan House evolved from the war on poverty. The idea was that people in the community should get comprehensive health care. And back when the center opened, it was really sort of a revolutionary idea that poor people should actually have their own doctor. Prior to the health center opening, an awful lot of our patients got all their care at the emergency room. The patients were always very warm, and I think they appreciated the fact that they had improved health care.
When my father came to Rochester, there was only one other black physician, and so my father was very important. People depended and looked up to him. It was his community. He lived here, so he wanted the best for his community and his surroundings.
Primary care today has to be different than what it's been for the last 20 years. It's no longer just come and see the doctor, get a medication, but it's more about coming to really explore what your health is all about and being involved in a team, which involves the patient's family, as well as the clinicians and the rest of the team members. Jordan Health Way is to provide a health home where care is of the highest quality, is compassionate, and that patients find that anytime they walk through our doors, they feel welcomed, they feel listened to, and they feel that when they finish with their visit with us, that it really met their needs, and that they leave feeling comfortable in the plan going forward.
The Jordan Health Center is around the corner from my house. Never paid any attention to it. Hadn't had a physical in 20 years because I'm feeling kind of good, right? So I'm walking around the corner, they take my blood pressure, and guess what? It's hitting the sky. So right away, they were very, very concerned, which amazed me. I'm gonna walk in. I just walked in off the street. But the staff, they were very, very professional. Called the ambulance for me. Now, I work out at the Y 3 times a week, faithfully. I'm the world top power lifter, male or female, at my age, 81. I'm one of the lucky ones, because if they hadn't noticed that I had a problem, I'd be 6 feet under, or a stroke.
I believe that Jordan Health today really has a finger on the pulse of the health of this community. Not only older folks, not only adults, but the children in our community as well, to be sure that they have a good, healthy start to their life and that we can continue it through the continuum of their life.
I've been really, really appreciative of the Jordan Health Center and Melody Murphy. She makes everybody feel so important and make sure that each person is treated equally. They allow you to pay as you go. That's a blessing. Because of the medical center, I'm young at heart, because I'm keeping on. And I love them and I thank them.
My dream for Jordan going into the future is that we are recognized as an innovative place for a health home for our patients, that we have demonstrable results that we can show not only locally but nationally, that Jordan Health is really recognized as a leader in healthcare, not only primary care but particularly for primary care for underserved populations. In the city of Rochester especially, There are many great organizations that are doing work to improve the life for the citizens of our city. What we need to do going forward is to continue to partner with these organizations so that we're working together. This might be in health fairs, this might be in building playgrounds for kids to really enjoy the life that the city has to offer.
Jordan provides medical, dental, psychiatric, but they also care about the patients. We're in the same world, and we should be good to each other.